Welcome to Abilities Lab 1. In this presentation, I'm going to introduce you to community pharmacy, why community pharmacy is so essential to our field, and introduce you to the exciting clinical opportunities that exist in community pharmacy. Then we will go over community pharmacy dispensing in Abilities Lab. Dispensing is at the core of community pharmacy, so I want to take a moment to explain just what it is and why is it so important to pharmacy. The Code of Maryland Regulations gives this definition of dispensing. The procedure which results in the receipt of a prescription or non-prescription drug or device by a patient or the patient's agent, and which entails the interpretation of an authorized prescriber's prescription for a drug or device, selection and labeling of the drug or device prescribed pursuant to that prescription, and measuring and packaging of the prescribed drug or device in accordance with state and federal laws. So what does that really mean? First, a prescription for a patient is received by the pharmacy. This could be in person, by phone, by fax, or electronically, depending on what the law allows, which we will discuss further in lab. The prescription then has to be interpreted and may need to be clarified. As we will discuss later, there are certain federal and state requirements for prescriptions that need to be met, not to mention that the pharmacist has to be able to clearly understand exactly what has been prescribed. Next, the pharmacist or technician needs to choose the prescribed drug, product, or device and label the vial according to all federal requirements. The drug then needs to be counted or measured to meet the prescribed quantity and be packaged and given to the patient. Even though I showed you how Maryland defines dispensing, this general definition and process of dispensing is true in all states. I'm sure most of us are familiar with the dispensing aspect of community pharmacy from visiting your local pharmacy, but you may be asking, why exactly is it so important to have community pharmacy? Community pharmacists impact lives on a daily basis. We promote health and overall well-being, prevent serious adverse drug reactions, and are the last line against medication errors. Our work helps keep people healthy, out of the hospital, and living their daily lives. But you may be wondering, well, isn't that true for all pharmacists regardless of setting? Isn't that what pharmacists in a hospital do, for instance? Yes, that's true. But there are certain responsibilities that make community pharmacists unique. First of all, being located out in the community makes community pharmacists the most accessible healthcare providers. Pharmacists are the medication experts, but what makes community pharmacists unique is that we are so easily available to people close to where they live and work. When patients are looking for over-the-counter remedies, we're the ones located right next to them to give advice and help them navigate all of their choices. We can provide important vaccines without appointments. Our location, even though it can range from retail chains to grocery stores to independent pharmacies, puts us closest to our patients and enables us to make a huge and continuing impact on lives. When we think of pharmacists providing immunizations, screenings, education, and health fairs, oftentimes those are our community pharmacists. Lastly, the most important unique aspect of community pharmacy is the long-term relationship with our patients. We see our patients often, monthly, or sometimes every 2 to 3 weeks as they pick up their medication for themselves, their family members, or stop in to buy an over-the-counter medication or grocery shop. This relationship is what allows community pharmacists to help patients monitor their medications, assist with adherence, and assist in patient outcomes. You might hear people refer to community pharmacy and clinical pharmacy as different things, but community pharmacy is absolutely clinical. Here are just a few of the clinical activities that community pharmacists are engaging in. Medication therapy management, or MTM, is a service that pharmacists provide to optimize drug therapy for individual patients. Oftentimes, MTM is performed by phone or in an individual one-on-one patient visit. MTM includes a wide variety of services that help to identify and correct medication-related problems and ensure that patients are on the best possible medication therapies for them. Point-of-care testing is simple medical testing that happens at or near the site of patient care and provides rapid results to patients in a convenient way for screening or monitoring purposes. Some examples of point-of-care testing that pharmacists can provide are cholesterol testing, blood glucose screening and hemoglobin A1C testing for diabetics, and INR to measure blood clotting in patients taking the blood thinner warfarin. Some opportunities in the future may even include screening patients for infectious diseases like flu or strep in the pharmacy. Depending on state law, pharmacists can now administer a very large variety of vaccinations, such as flu, shingles, pneumococcal, tetanus, diphtheria, and pertussis, also known as Tdap, and meningitis. In Maryland, pharmacists are now able to administer any CDC-approved vaccination without a prescription to patients ages 18 and older, those ages 11 to 17 with a prescription, and we can provide flu shots to those 9 years and up. Community pharmacists can also work with other healthcare providers to assist in drug therapy management. This is often done through a collaborative practice agreement, an agreement that allows pharmacists to provide services that are typically outside of a pharmacist's scope of practice, including initiating therapies and modifying current regimens. For example, a pharmacist under a collaborative practice agreement for diabetes could assess the patient's A1C and blood glucose values and determine if any additional adjustments in their medications or lifestyle behaviors are needed. Then the pharmacist could actually make those medication dosage adjustments on behalf of the physician without directly contacting the physician for a prescription. I encourage you to explore these areas and more. Do your own research and talk to practicing community pharmacists to get more examples of all the things we can do in the community. You may have noticed that community pharmacies usually have a whole team of people working together to accomplish all of these tasks. Of course, there is at least one pharmacist always present in a pharmacy. Pharmacists are licensed by the State Board of Pharmacy and are the only members of the pharmacy team that are able to verify or perform the final comprehensive check of a prescription. Pharmacists also provide counseling on prescription and non-prescription products and answer drug information questions from patients and other healthcare professionals. Pharmacists triage patients to the most appropriate place when needed and provide overall oversight and guidance for the rest of the pharmacy team. Ultimately, the pharmacist is responsible for everything that happens in the pharmacy. Pharmacy technicians are also licensed by the State Board of Pharmacy and assist the pharmacist in a wide variety of functions. Technicians may accept, input data from, and prepare prescriptions for the pharmacist's final check. They also assist in maintaining patient history, prescription records, and managing inventory. Technicians are also instrumental in billing insurance and helping to resolve insurance claims so that the patient can afford their medications. While pharmacy technicians are able to do many things in the pharmacy and are truly instrumental in the functioning of a pharmacy, it is important to know that all clinical questions must be referred to the pharmacist and that only the pharmacist can check a prescription before it is given to a patient. You may also come across clerks in community pharmacies. Clerks are also very important and can receive prescriptions, ring out prescriptions and other merchandise at the register, receive shipments, greet patients, and direct any questions to the appropriate person to make the pharmacy run as efficiently as possible. However, clerks are not licensed by the Board of Pharmacy and should therefore not be performing technician functions like inputting and filling prescriptions. Pharmacy interns, like pharmacists and technicians, are licensed by the respective State Board of Pharmacy. Interns are typically pharmacy students, but could also be recent graduates or graduates of a foreign pharmacy school. Depending on specific state laws, pharmacy interns, under the supervision of a licensed pharmacist, can assist with a variety of more advanced clinical functions, such as vaccinations once certified, patient counseling, answering drug information questions, and the dispensing process, although only a licensed pharmacist can perform the final verification on a prescription. Of note, Maryland recently created an intern license that went into effect on July 1st, 2015, and allows second, third, and fourth year pharmacy students to engage in these more advanced functions similar to experiential rotations through school. As I've already alluded to, there are many different aspects that make up community pharmacy. Community pharmacy includes dispensing, counseling, drug information, triaging patients to the appropriate place, such as their physician or even the emergency room, and promoting health overall, just to name a few examples. Community pharmacy is always growing and expanding. While dispensing is a very important role for community pharmacists in helping patients safely obtain the right medication, community pharmacy has become so much more and will likely involve even more opportunities by the time you graduate. Now we're going to look at how all of these activities can be accomplished in a community pharmacy. Workflow describes the process of organizing resources and personnel to optimize the efficiency of performing a task, in our case, dispensing and other pharmacy functions. The typical order of community pharmacy workflow involves receiving a prescription from a patient, inputting prescription data into the computer, filling the prescription, pharmacist verification, prescription release to the patient, and patient counseling if appropriate. For a great visual representation of this process, check out the workflow infographic in Blackboard. Having an organized workflow in the pharmacy is important for several reasons, but the most crucial is patient safety. When proper workflow is followed, everyone clearly understands who is responsible for what, and each prescription ideally would have multiple people checking it before it reaches the patient. This reduces the likelihood of errors and increases the odds that somebody will catch an error before the prescription is released from the pharmacy. An organized workflow also allows for efficiency, where each person in the pharmacy is best utilized. Here is an example of how a pharmacy's workflow might look in a community pharmacy with 2 technicians and 1 pharmacist. Tech A receives prescriptions and also rings out prescriptions with the register. A patient drops off a prescription and Tech A obtains it. Tech A then hands it over to Tech B. Tech B checks the prescription to make sure it is legal and has all the required components of a prescription in order to fill. For example, does it have the patient name, the drug, the strength, directions, refills, and prescriber signature? After verifying it is correct, Tech B then proceeds to process and fill the prescription. Then Tech B gives the prescription to the pharmacist, who does the final prescription verification and provides any counseling needed to the patient. The prescription returns to Tech A, who serves as the cashier and rings the completed prescription out to the patient. In this pharmacy's workflow, the prescription is checked by at least 2 people, decreasing the likelihood of errors. In some pharmacies, there's a separate physical location for each step of the workflow process. However, sometimes more than one step may happen in the same physical location. For example, the initial prescription verification and prescription processing might both happen at the same computer terminal at the front counter. In Abilities Lab, we learn real-life skills for community pharmacy. For the next few weeks, we will focus on the dispensing process. Let's go over the key components of dispensing that you will do not only in Abilities Lab, but also out on rotations and beyond. When receiving a prescription, we first have to verify that the prescription is legal and appropriate. Federal law requires that all prescriptions list the date written. This is important because we want to make sure that the patient has been seen and evaluated by a prescriber recently. A prescription written for a patient 6 months ago may no longer be appropriate. For this reason, federal law also requires that the first fill of a prescription be within 120 days of the written date. Federal law also requires the patient's name so that we can ensure the prescription is given to the correct person. Prescriber's name and signature are required so that we know who authorized the prescription if we need to contact them for clarification or to request refills when the prescription runs out. As a reminder, pharmacists cannot prescribe medication, so a prescriber's signature is essential. We also need to make sure that the drug name, strength, quantity, and directions for use are all on the prescription so that we can dispense what the prescriber intended. Refills, while not required on a prescription, should still be checked to see if they are appropriate. If no refills are noted on the prescription, it often means 0 refills. Controlled substances have limitations on refills. For example, Schedule II control prescriptions may not be refilled. Schedule 3 through 5 prescriptions may have 5 refills within 6 months of the written date, and non-controlled prescriptions are not limited on refills, but best practice is to not provide refills 1 year from the date written to ensure that the patient is still being seen and evaluated by a prescriber. For controlled substances, class 2 through 5, a prescription must also contain the patient's address to further verify the correct patient. It also requires prescriber address and prescriber DEA to ensure that the prescriber is legally authorized to write for that controlled substance. It is vitally important that all prescriptions meet all legal requirements prior to filling. Otherwise, we would not be following state and/or federal regulations. For all pharmacy laws, we always go by whichever law is the most strict, whether it is the federal law or the state law. Currently, the state of Maryland has these same requirements as we just mentioned. The pharmacist also needs to assess if the prescription is safe and appropriate for the patient. For example, does the strength exist for this medication? Do the directions make sense? Is there any information that is missing? For these issues, oftentimes the pharmacist must call the prescriber to verify the prescription. Any changes the prescriber makes, the pharmacist will need to document on the hard copy of the prescription. This change should be completed in pen. This is done by drawing a single line through the change, noting the correction. The pharmacist should then initial their name, write the date, and the name of the person who authorized the change. The change could come directly from the physician or someone in the physician's office on the physician's behalf, such as a nurse. There are some instances where clarification about a prescription could be completed by verifying with the patient. For instance, when metoprolol succinate is given for hypertension, the dose is 25 to 100 milligrams daily. But when metoprolol succinate is given for heart failure, doses start as low as 25 milligrams daily and go as high as 200 milligrams daily. In order to make sure the dose is appropriate for the patient, you may need to ask them what he or she is taking it for. This is a great example of the important role pharmacists play in verifying prescriptions. It is solely your job as a pharmacist to make sure that the prescription is correct. Never assume that what the prescriber wrote on the prescription is correct. We all make mistakes, including prescribers. Ideally, the pharmacist should verify the appropriateness and safety of the prescription prior to processing and filling the prescription. Why? Because otherwise, time is spent filling the prescription, and then it turns out there's incorrect information, and the prescription has to be reprocessed and filled again. Oftentimes in a pharmacy, the technician does a brief check on a prescription prior to filling. A technician could troubleshoot simple issues, such as there is missing information on a prescription or the strength is no longer available. Then the technician can bring the prescription to the pharmacist to resolve the issue. In Abilities Lab, you are provided a community pharmacy prescription processing checklist. This checklist assists you in ensuring you complete all of the components of dispensing. These components include items that are required by federal and/or Maryland state law, as well as best practices. Best practices are procedures that are considered most effective by the majority of practicing pharmacists. Items that are required by federal and/or Maryland state law have a check mark next to them. Here on the screen is the first part of that checklist, the initial prescription verification that we just discussed. In lab, you will act as the pharmacist and check the prescription to make sure it is both legal and appropriate for the patient. Note all of the components on the checklist to help you through this process. Once a prescription has been initially verified, it can move on to be processed and filled. Processing and filling a prescription is often completed by a pharmacist or a technician. Whoever is filling the prescription will need to select the correct medication, including the correct strength and formulation. It is important to see if the prescription is written for brand name or generic. According to Maryland regulations, the generic equivalent drug or device may be substituted for the brand name product unless the prescriber or patient requests the brand name. In summary, pharmacists will fill for the generic drug unless requested. We will talk more about this in a few slides and discuss how to document this with a dispense as written or DAW code. The filler should also check that the medication stock bottle is in date. We cannot dispense medication that is expired. Lastly, the filler should check the medication stock bottle to ensure that the right medication was obtained. This can be completed by checking the National Drug Code or NDC number. The NDC number is a unique 11-digit 3-segment number. It is unique for every medication. The first segment has 5 numbers and denotes the manufacturer. The second segment has 4 numbers and is unique to a specific medication and strength. The last segment has 2 numbers and denotes the package size. Here's an example on the top left side of this slide. 12345 is the manufacturer code. 1234 is the specific product code. For example, metoprolol succinate 25 milligrams. And 12 is the package size. This could be for a bottle of 100 tablets. Many times, zeros before an NDC segment are not written to reduce confusion. Take a look at this label of a fluoxetine bottle on the bottom left. The first segment has 5 numbers, 16714. The second segment only shows 3 numbers, 353. What that really means is 0353. This is important because you may need to type in an NDC number in the computer and would need to input all 11 numbers, including zeros. So how do we use NDC numbers to check that we've obtained the correct drug? Oftentimes, a pharmacist or technician will input the prescription information in the computer, print out a prescription label, and then go to grab the medication stock bottle from the shelf. The prescription label will have the drug and the drug's NDC number. On the right-hand side of this slide is an example of what a label looks like in Abilities Lab. You can see that this naproxen label has an NDC number. The pharmacist or technician can then match the label's NDC number to that on the medication stock bottle to ensure that he or she has picked up the right drug. As promised, let's discuss what dispense as written or DAW codes are. DAW codes are a vital part of dispensing prescriptions in a pharmacy. They are simple 1 or 2-digit codes that are inputted into the computer system for documentation and for insurance billing. Here's an example of a prescription you may see in Abilities Lab. The prescriber may prescribe the brand or generic name for a drug. As mentioned previously, if the prescriber doesn't indicate on the prescription that he or she would like the pharmacist to dispense exactly the medication written, the pharmacist may substitute it for the generic drug. If that was the case, it would be DAW 0, which means no product selection indicated. Choose this if the prescriber does not write a prescription for dispense as written. If the prescriber wishes to have only the brand name drug dispensed, he or she could indicate this by writing dispense as written, checking a box, or signing on a specific line to indicate dispense as written. In that case, it would be DAW 1, which means substitution not allowed by the prescriber. On this example prescription for Zestrol, a specific line for signing is available. Dr. Thedford would only like the brand name Zestrol to be prescribed to Ms. Smith. Let's say, for example, that the prescriber writes for Zestrol 20 milligrams and substitution is permissible, but the patient prefers the brand name of the drug instead. In this case, it would be DAW2. Substitution was allowed, but the patient requested the product dispensed. There are other DAW codes, but they are not used as commonly. I would suggest reading these over as they are still important for rotations, the NAPLEX, and beyond. Here is the Abilities Lab checklist again to help you through the steps of processing and filling a prescription. We just discussed that obtaining the correct drug that is not expired and inputting the correct DAW code is important. Be sure to watch the community dispensing video that goes over how to use the Abilities Lab computer system for dispensing. The last item on this part of the checklist is something we do specifically in our Abilities Lab community pharmacy. We would like you to write the middle 4 NDC numbers, the second segment of the NDC number, and your initials on the front of the prescription. This documentation should be completed in pen, and this process is basically to act as a check. This means that whoever processed and filled this prescription has verified that they obtained the right medication and checked the NDC number. When that person initials, they are stating that they attest to the fact that they have obtained the correct medication. Now that the prescription has been processed and filled, it is ready to go through the final verification by the pharmacist. Pharmacist verification is done to ensure that the prescription is safe and appropriate for the patient. It also confirms the accuracy of prescription processing and filling, helps to identify and prevent possible drug interactions, and identifies any need for counseling. The first step for pharmacist verification is to check that the prescription is legal, as well as safe and appropriate for the patient. This could have been potentially done earlier in the workflow process. Here are the steps again on how to check for legality and safety. Next, the pharmacist should check that the verification was processed and filled correctly. This includes checking that everything on the prescription label was correctly transcribed from the hard copy prescription. This includes patient name on label matching the prescription, drug name on the label matching the prescription, and if substituted, be sure to include the brand name, generic name, and manufacturer. The drug strength on the label should match the prescription. Formulation listed on the label should match the drug in the vial, for example, tablets versus capsule if appropriate. The directions on the label should match the prescription, and refills on the label should match the prescription. Prescriber name on the label also needs to match the prescription. The correct prescription expiration date should be on the label, and the correct discard after date needs to be on the label. To further clarify, the prescription expiration date is the date when the prescription expires and a patient can no longer ask for additional refills. For C3 through 5 controlled medications, this is a total of 6 months after the date written on the prescription. For non-controlled prescriptions, this is 1 year after the date written on the prescription. 1 year may mean slightly different things depending on what pharmacy you're in. For a prescription written on May 11th, 2014, 1 year could be any of expiring on May 10th, 2015, May 11th, 2015, or May 12th, 2015. You may choose any of these 3 options as a correct prescription expiration date in Abilities Lab. The RX expiration date is different from the discard after date. The discard after date is when the medication that was dispensed expires. This is related to the stock bottle. The discard after date will be the sooner of either the expiration date printed on the stock bottle. If the day of the month is not specified, example if it says January 2015, then you would use the last day of that month, or January 31st, 2015. Or it could be 1 year from the date of dispensing, with the same rules applying as above. And always make sure to pick the sooner of these two dates. For example, if a prescription is written on May 5th, 2014, and filled on May 11th, 2014, and the stock bottle says January 2015. Here, the discard after date would be January 31st, 2015, when the stock bottle expires, since this is sooner than a year from the dispense date. If a prescription is written on May 5th, 2014, and filled on May 11th, 2014, and the stock bottle says November 1st, 2015, the discard date would be May 11th, 2015, or May 10th, or May 12th. In this case, the sooner date would be 1 year from the date that the medication is dispensed. After you've checked that everything on the prescription label is correct, it's time to check the medication. Does the quantity of the drug dispensed match the prescription quantity? You can check this by counting the number of tablets or capsules in the vial. For practice in Abilities Lab, you should physically count the number of tablets or capsules in the vial to ensure the correct amount is dispensed. You should also check that the drug is not expired. This can be completed by checking the medication stock bottle's expiration date. Lastly, appropriate auxiliary labels should have been attached. In our pharmacy, up to 3 auxiliary labels can be attached. These auxiliary labels often do not match the system codes, so do not depend on them. If the prescription is a controlled substance, a federal transfer sticker should also be attached. In Abilities Lab, there are certain items that we would also like you to do as part of best practices. This includes making sure that the back tag is affixed to the original prescription. The back tag is a copy of the label that pharmacists use to verify a prescription and its label. In Abilities Lab, this back tag should be affixed to the back of the hard copy prescription. Here's that checklist again. This is the checklist you would use in Abilities Lab to ensure that you have successfully completed verifying a prescription. The items with a check mark are required by law. So why do we practice these skills in Abilities Lab? Dispensing is very important in a community pharmacy. Prescriptions need to be checked before you start to fill them so that you don't waste time and resources and fill a prescription before the pharmacist notices a mistake was made and you have to start all over. It's also important for safety to have another person besides the pharmacist looking over a prescription. Verification is key since the pharmacist is ultimately responsible for the prescription being dispensed. Verification is a last chance to check the prescription for accuracy and appropriateness and to identify any further clarification or counseling that may be needed. The process of dispensing is the same in all community pharmacies, even though vials, labels, and computer systems used may be different. By being familiar with the general dispensing process, it will be much easier to adapt to specific differences among pharmacies. Lab will also cover real-life community pharmacy processes like filling controlled Class 2 prescriptions, or C2s, reconstituting medications, and filing prescription records. You should now have a good basic understanding of what we do in community pharmacy and what makes it unique. By reviewing this information and other pre-lab materials, you should be ready to start practicing dispensing in lab and prepare for your future as a pharmacist.